David Lammy.
I'm very grateful, Mr. Deputy Speaker. Two years ago, a friend of mine collapsed on a football playing field and the ambulance was called. The ambulance should have arrived for this major emergency within 8 minutes. It took 17 minutes and my friend died of a heart attack on that field. The seriousness of this debate to many families beyond this chamber, and I think of his wife and 3 children left behind, cannot be conveyed, frankly. So it's right to begin by saying that the £700 million that has been found and the £150 million for the Challenge Fund are absolutely desirable and necessary at this time. And I remember in my own role as a minister in the department dealing with a winter crisis that those funds are very, very important indeed. But I just want to take the House back to a dark time in the NHS when it was routine to wait in A&E for 6, 8, 12 hours, and what it took to change that system. It was a great privilege for me to begin my ministerial career in the Department of Health. The former member for Darlington was busy at that time, controversially, dealing with foundation hospitals. The former member for Bower-in-Furness was busy at that time, controversially, dealing with nurses' pay and increases that we wanted there, but also with the GP contract. And I found myself leading on emergency care, and I was the minister that led through the changes for that A&E target. We brought in Professor Sir George Alberti. It was hugely important to have a clinician leading the charge across the NHS. This was important for a number of reasons. It was important because you needed to persuade the GPs about access if this was to work. We brought in the target, 48 hours, since abolished, but we also brought in a lot of practice at the front door of A&E. The phrase that we were using all the time at that point was see and treat and triage. But it only worked if you looked at the system as a whole system. That meant important targets in the rest of the hospital were necessary. This is in cancer, in cardiac care. It's a crying shame, frankly, that when you look at the 15 major targets, 7 of them were missed under this government. You also needed to deal, of course, with social care. It must be the case that if you take 3.53 billion out of social care, there will be consequences. Right. And let us remember that much of this debate has been figured in the past tense. There are further cuts to come. Day centres to be closed. You see these phrases that pop up in local authorities, like new pathways for the elderly. New pathways to what? Exactly. New pathways to isolation. New pathways to falling over at home on your own. New pathways to going without food. New pathways to ending up at the door of A&E. We also introduced NHS Direct. In my time, it was about ensuring that those nurses could deal with the calls promptly and move on. I never conceived that we would actually get rid of the nurses in NHS Direct, that we would move solely to a system of algorithm. Is it surprising then that people are directing people to the door of A&E? And the system worked also because time and time again you saw before the A&E those walk-in centres. You can call them urgent care centres if you want, but they're essential. They're part of the triage, part of the see and treat method that you needed. And again, 1 in 4 of them lost, and the crisis that we see in front of us. And here in London it gets worse, because we're losing A&Es. Gone at Chase Farm, gone at Hammersmith, gone at Central Middlesex, going perhaps at Epsom and St Helier, gone at Charing Cross, in a population rising to 10 million. So this is a serious debate, because it's about to get worse. No wonder the chief exec of the London Ambulance Service resigned yesterday. She's leaving a sinking ship under this watch. And this House will remember, and the people will remember, because it is specious of the Secretary of State to come to this chamber and say the debate is solely about more nurses and more doctors. It is not. It is about the system, the NHS. Who is accountable under this new structure? Is it NHS England? Is it the CCGs? Is it the CQC? Is it another jargon figure? No one is responsible. Certainly the Secretary of State isn't, because he gave up those responsibilities in 2012. That's the mess this government got in without even putting it in the manifesto. It's a disgrace, a disgrace.